Everyone, I hope I'm live. Can you people see me? Can you people hear me? Give me a minute to confirm. If visibility audibility is great, I will start the class ahead. Give me a minute. Yeah, I hope it is working. Yes, I hope it is working. So I welcome you all for today's session. I am Dr. Priyanka here, educator on Unacademy. So here I am too. We have started a series in community medicine. In community medicine, I have started epidemiology. I have already started epidemiology. We have covered 3 lectures on epidemiology and this is episode number 4. So in this episode number 4, I am going to continue the measures of morbidity. Till now, we have completed what is rate, what is ratio, what is proportion, number 1. Then we have started the measures of mortality. We have already covered the 6 measures of mortality and we have started the measures of morbidity. In morbidity, we have seen there are only 2 measures, incidence and prevalence. We have just finished incidence and prevalence in the last lecture and now we will do some numericals based on incidence and prevalence, some polls. So give me a minute to jump directly on the slide where we have left. You have to give me a minute so that we can go there. Okay, so we have covered incidence and prevalence and we have seen the relationship between incidence and prevalence. So this was the relationship. So let me summarize. Incidence and prevalence. Incidence and prevalence both are measures of morbidity. It is not mortality, it is morbidity. Incidence and prevalence. In incidence, we calculate only new cases. In prevalence, we calculate all cases. That is new plus old that we have seen in the last lecture. This is the numerator in both of them. In denominator, new cases upon population at risk. In prevalence, new cases, all cases upon population at risk. So in both of them, we are taking population at risk in the denominator, right? The third difference which occurs between them is the multiplier. In incidence, the multiplier is 1000. In prevalence, the multiplier is 100. So based on that, you can say incidence is a rate because multiplier here is 1000 and prevalence is a proportion. P for P. P for P. Prevalence is a proportion. Proportion. It is not rate. It is proportion because multiplier here is 100. So please everyone learn the formula for incidence and learn the formula for prevalence. If you know these two formulas, we can move ahead and solve the numericals based on it. You know this formula? After this, yeah, this is a rate, this is a proportion. Incidence is used for controlling the disease, number 1. It is used for therapeutic measures. It is used for preventive measures. It is used for research purpose. It is used for knowing the etiology and pathogenesis of the disease. Prevalence is used for planning and administrative purpose for any new hospital, right? So these are the uses of incidence and prevalence. After that, we have covered the relationship between them. So you can see this is the relationship between incidence and prevalence. So we have seen that prevalence is equal to incidence into duration of the disease. Duration of the disease. So you can see prevalence is directly proportional to incidence and prevalence is directly proportional to duration. So once you increase the incidence, it will be increased, it will decrease, it will decrease. Same with duration. If you increase the duration, prevalence will increase. If you decrease the duration, prevalence will decrease. So here I taught you two concepts. What were the two concepts I have already taught you in this formula? The two concepts which I have already taught you is this. What is the effect of treatment on prevalence and what is the effect of vaccine or immunization on prevalence? So treatment works on duration. Treatment works on duration. So there are two types of treatment. There are some treatment for some disease which cure the disease, so they decrease the duration, so they decrease the prevalence. There are some treatment which do not cure the disease, like diabetes, like hypertension. They control the disease so that they are increasing the life of diseased person on earth on that particular area. So they are increasing the duration of diseased person, increasing the duration of disease. So they are increasing the prevalence. So the summary is that treatment can decrease the prevalence, can increase the prevalence, can do both the prevalence. But what about vaccine? Vaccine works on incidence. By giving vaccine, you decreases the incidence of new cases, right? If the person is already vaccinated, the disease will not happen. So prevalence will automatically decrease. So vaccine always decrease the prevalence, but treatment can increase as well as decrease the prevalence. This is the summary which I have taught you in the last lecture. So let me move ahead. We have already covered all these the important things, right? So we will solve some polls here. We will solve some MCQs, some polls here. So here is the first numerical in front of you. Those who are live can try and attempt. They can try and attempt. Let me see. Let me see. Yeah. So anyone want to try it? Anyone want to try it? Okay, let me read it. incidence of a disease in a population of 30,000 and 300 new cases. So the question, the examiner is asking to calculate the incidence, right? Apply the formula for incidence. What is the formula for incidence? Incidence is equal to number of new cases upon population at risk into 1,000. Into 1,000. This is the formula. Apply it in the question. Please apply it. So how many new cases are there? 300 new cases of a disease. The disease is not mentioned. Any disease. It is some disease, right? Population at risk. Now population is given 30,000. So I'm considering this population as population at risk only. So it is 30,000 into 1,000. So 1,000 se 1,000 we are cancelling. 0 se 0 we are cancelling. So answer will be 10 per 1,000. So answer will be 10 per 1,000. So answer here will be B. Yes, Rishinika Iram. Very good. The answer will be B. So this is how it was a very simple question. And you can, of course, we have done the calculations. You have to solve. You have to keep it in mind. It is calculated per 1,000. Now, instead of per 1,000, if the question contains per 100, further you have to do a little bit one step ahead, right? So question में एक चीज ध्यान रखना है, per 1,000 you are calculating. In the question per 100, per 10, anything can be asked, right? But in this option, luckily, all options are per 1,000 only. So it is a simple numerical. Let me move ahead to the second question. This is the second question. Rishinika, Ira, do you want to try it first? Please try it. So calculate the prevalence. The examiner is asking you prevalence. If incidence is 2 cases per 1,000. So incidence is given 2 cases per 1,000. It is already given to you the value of incidence is 2 cases per 1,000 per year. This is the unit of incidence. I have already taught you the unit of incidence per 1,000 per year. That is incidence. And duration of the illness is 4 years. Duration. So you are given 2 values in the question. What is incidence? It is 2. 2 per 1,000 per year is the incidence. And what is duration of illness? Duration of illness is 4 year. Year is the unit. Here 2 and 4 are given. So what is the value of prevalence? Formula of prevalence. Prevalence is equal to incidence into duration. We know this formula. So apply. Incidence is 2 per 1,000 per year. Right? Per 1,000 per year. Right? Into 4 year. So year se year cancel. So it is 8 per 1,000. 2 into 4 it is 8. So answer is 8 per 1,000. Have you got it? Year se year cancel ho gaya. You all are right, Rishinika, Iram. Very good. Very good. The correct answer here is A. So this is also a very simple numerical. It was simply you have calculated prevalence is equal to incidence into duration. So it is 2 into 4. It is 8 cases per 1,000. Year se year cancel ho gaya. Right. So again you can see this discussion. Rishinika, Iram. Yes. So most of the students watch my lectures as recorded one. So live students are less, but still you can give a try. Okay. Okay. We will see. I will read the question for you. In a town of population 5,000. So 5,000 is the mid-year population of that town. If alag se, if separately population at risk is given, I will consider that. Otherwise, I will consider this population as population at risk. Okay. 500 are already myopic. 500 already have the disease. On the 1st January 2011, they are already myopic. Now, number of new cases, new myopia cases is 90 throughout the year from 1st January till 31st December. Throughout the year, these are the new cases. The new cases are 90. Calculate the incidence. What is the formula of incidence? What is the formula of incidence? Calculate the incidence. Who will tell me? It is a tricky question. Rishinika, Iram. It is tricky. Don't rush. It is tricky. What is the formula of incidence? Incidence is equal to number of new cases. Here, clinch in the question lies at population at risk. What is denominator you have put? Rishinika, denominator kya liya? What is the denominator you have put here? New cases upon population at risk into 1,000. So go slowly, step by step, please. New cases is crystal clear. New cases, new myopic cases in the entire year, starting from 1st Jan till 31st December, it is 90. So of course the value is 90. There is no doubt in it, the value is 90. But what is population at risk? Have you took 5,000 as denominator? 5,000 is the mid-year population. It is the total population of that town. Whatever town it is, Mumbai, Delhi, whatever town it is. So of that town, the total population is 5,000. But 500 are already myopic, so they will not have repeat myopia. They have the immunity, right? So population at risk is 5,000 minus 500. It is 4,500. That was the clinch in the question. So 4,500 is population at risk because the ones who are vaccinated and the ones who are infected, we exclude the two things from mid-year population. So you exclude the vaccinated person and you exclude the infected person from mid-year population. So you will get population at risk. Population at risk. So the remaining, so out of 5,000, 500 already have infection, if they have already have myopia, they will not have repeat myopia, no? Right? They are already myopic. So just exclude them. So population at risk is only 4,500. That was the clinch in the question, right? So Iram, not 500. You have to take 4,500 as the denominator into 1,000. Now do the calculation. Whatever answer come, it will be your answer. You can do the calculation. So, you can do it by yourself. I'm not doing the calculations. So answer will be not D, not 18, Rishinika. Answer will be 0.02. So here, so it is the new cases. The new cases is 90. There is no doubt in it. But doubt, most of the students took 5,000 as denominator. Don't take 5,000 as denominator. Take 4,500 because population at risk is 5,000 minus 500. That is 4,500. If you do this calculation, your answer will be 0.02. You can into 1,000 also, of course. Into 1,000. Your answer will be 0.02. Yes, Rishinika. Yes, have you got it? It was a good question. This is a question from AIMS few years back. Few years back, we don't have INICT. We have AIMS, right? So AIMS ka question hai. You can check it out. Everyone give me a thumbs up. So the clinch in the question was that 500 are already myopic. You have to subtract this. Instead of already myopic, the examiner can give 500 are vaccinated. Then also your denominator is same 4,500. You have to exclude vaccinated or infected person from the total population to get population at risk. If there's nothing 500 के बारे में कुछ नहीं दिया रहता in the question, just imagine nothing is given. Population of town is 5,000. That is the only information. So we will consider all 5,000 as population at risk. If nothing is given, we will consider all of them are at risk. No one is vaccinated, no one is infected. But here additional information is already given, so you can't neglect that. Give me a thumbs up. Iram, Rishinika, give me a thumbs up. Everyone give me a thumbs up. We will do one more numerical. It is in front of you. Please try it out. Okay, I will read it for you. In a population of 5,000, please try it out. In a population of 5,000. So total population is 5,000. Incidence of a disease is 100 in 1 year duration. So 100 per 1,000 per year, right? Duration of the disease studied is for 2 years. Duration is 2 years. So what is the prevalence? It's a simple question, I guess. Very simple question. So what is the prevalence? Which formula of prevalence you will apply? There are two formulas for prevalence. The first formula is all cases. That is new plus old upon population at risk. Population at risk into 100, not 1,000, 100. This is the first formula. Second is prevalence is equal to incidence into duration, which you will like to apply, Now look what information the examiner is giving to you in the question. Depending on that, decide your formula. In the question, population is given, so I will consider this population as population at risk only. Population at risk is given to you. It is 5,000. Total population ko मान लो because nothing to exclude. Everyone is at risk, right? Incidence is given to you. Incidence is 100 in 1 year, and duration is 2 years. Duration is 2 years. So of course, in the first formula, population at risk is given, but total cases are not given, no, old and new. So you cannot apply this formula. So go with this formula. Incidence is given, duration is given. So this information is just to confuse you. Which information? Population at risk. Just to confuse you, it is given. There is no need of this in this formula. Is it required? Yes or no? I'm asking to you. Is it? Is it? So what you will get? So what is the incidence? Incidence is 100 in 1 year. And duration of disease is 2 years. So you have to calculate the incidence. Okay. I'm sorry. Incidence of the disease is 100 in 1 year. 1 year. Okay. Just a second. It is 100 is the new cases given. Actually not incidence. It is the new cases is 100 in 1 year. So first calculate incidence by putting 100 in the numerator. 100 by 5,000 into 1,000. First calculate 20 per 1,000 per year. 20 per 1,000 per year. Means what does it mean? Listen. What is the incidence? Okay, incidence is given. According to you, ma'am, incidence is given. But incidence is only 100 in 1 year. It is per 1,000. But what will be in the 5,000? In per 1,000, it is 100. In 5,000, it will be 20 per 1,000 per year. Right? And so then apply the formula of prevalence. So there is a little bit confusion in the question. Maine thoda sa, I guess instead of incidence, I should type new cases. New cases. Right? So you will get correct answer. Right? Okay. Let me move to the next question. Don't worry. Move to the next question. This is the next question in front of you. In a population of 5,000, there was a little bit confusion in the last question. Instead of incidence, the question should have new cases. Right? Anyways, leave that. So come on the next question. In a population of 5,000, number of new cases is 500. So total population is 5,000. Number of new cases is 500. Old cases in the same population is 150. So new cases, new is 500 and old cases is 150. And total population at risk is 5,000. You tell me prevalence. Who will tell me prevalence? Prevalence. What is the formula of prevalence? Apply it. The formula of prevalence is all cases. That is new plus old upon population at risk. So all cases include new plus old. So it is 500 plus 150. Let me see. So 500 plus 150, it will be 650. 650 in the numerator. Say yes or no. And denominator is population at risk. That is 5,000. Yes. So it is 5,000 and into is 100. It is prevalence. It is not incidence. You cannot put here 1,000. It is always 100 because it is a proportion. It is not rate. So do the calculation. Whatever answer is coming, it will be the answer. I will not help you in mathematical calculations. Please excuse me for that. Right? This is not a mathematics class. So you have to do the calculations by yourself. I can give you the concept that what is the numerator, what is the denominator, what is the multiplier. Now you do the calculations by yourself. I will not do it for you. Right? Okay. So yes, Iram, correct. Rishinika, correct. The answer is 13. So it was an easy question, I guess. So the examiner has given you total, not total cases, population, the new cases, the old cases. So you have to add new plus old to find all cases. So all cases is new plus old upon total population into 100. So it is 500 plus 150 upon 5,000 into 100. Right. So this is 650 upon 5,000 into 100 and you can solve it. Everyone give me a thumbs up. Everyone. So we have done it. Okay. Now the numericals are over. Now some conceptual difficult questions for you based on this concept. This is the conceptual question. It is a difficult one. It is a difficult one. I'm warning again, Rishinika, Iram. It is a difficult one. Don't rush. Read the question. There is a drug in the market available. A new drug available in the market which does not cure the disease but decrease the symptom and increase the survival. That is, it is controlling the disease. It is not curing the disease, but it is controlling the disease. Symptoms को control कर रही है और survival time बढ़ा रही है. So the person is not cured, but the disease is under control. So that drug is doing what? Increasing prevalence, increasing incidence, decreasing prevalence, decreasing incidence. So you have to understand it. You have to understand it. What that drug is doing. What that drug is doing. So the disease has already occurred now. So nothing to do with incidence. Nothing to do. Incidence is the new case. Disease has already occurred. So you are already, the patient is already a new case. So there is nothing to, now drug cannot act on incidence. The drug will act on duration. The treatment will, the vaccine can work on incidence, but the treatment will work. The drug is a treatment, it is not a vaccine. So the drug will work on the duration. But there are two types of treatment. The treatment which cure the disease, the treatment which control the disease. Does not cure, but control the disease. So the drug which cure the disease, decrease the duration of illness, so decrease the prevalence, right? The drug which controls, it increase the duration of illness, so it increase the prevalence. Yes, Rishinika, the correct answer is A. Very good. The correct answer is A. This concept I have already explained you. That's why you both are right. You both are right. But if someone, imagine you don't know this concept, you will not go with this option. You will get confused, right? You should have concepts, right? Okay. This is the next question in front of you. All are true about incidence except. So which is false? Which statement among the following is false about incidence? You tell me. All are true about incidence except. Which of the following is false? You tell me which of the following is false. You tell me. So numerator include new cases. Is it false or true? Denominator includes population at risk. Is it false or true? Does not include unit of time. And incidence is a rate. So yes, it includes new cases. What is the formula? It is new cases upon population at risk, right? And it is a rate because the multiplier is 1,000. But it always increase time. It always increase time. It does not include time. This statement is wrong. So correct answer is C because this statement is wrong and in the question false is asked. So correct is C. Yes, you all are right. The correct is C. You got it because it always include unit of time, right? Okay. The next question is in front of you. I will read it for you. If the prevalence is very low as compared to incidence, if the prevalence is very low as compared to incidence, what does it mean? Now it is a difficult question. Again, I'm warning Rishinika, Iram, I'm warning. If the prevalence is low as compared to incidence, when it can happen? You tell me. So prevalence is equal to incidence into duration. You tell me. It looking at the formula, the value of prevalence is always more than incidence because incidence into duration when you will do, you will get prevalence. But you are saying prevalence value is low as compared to incidence. Incidence is high, but prevalence is low. When it can happen? When it can happen? Imagine a disease in which new cases are more. The new cases are more. Incidence is high. Incidences means new cases. New cases are very more, but total cases are less. Total case, when it can happen? I'm asking to you. Disease is very fatal or easily curable, or disease is non-fatal, or calculation of prevalence or incidence is wrong calculation is done, or nothing can be said. They are independent. What you will go? What you will go? Who will tell me the correct answer? Iram, you are saying A. What about Rishinika and other persons? What about other persons? When this thing can happen, it is a difficult question I am asking you. Yes, anyone? What is the correct answer? Yes, A is the correct answer. Now imagine a disease in which incidence is very high. It is very common. New cases are very common. But all of them either get recovery very fast or they are dying very fast. So the best treatment available, so they are getting cured. Or the no treatment available, so they are dying. So duration is very less. Duration. So overall total cases are less. Incidence, although incidence is more, but prevalence is less. So disease is either very fatal or easily curable. Everyone give me a thumbs up. So correct answer here is A. Correct answer here is A. So you have to understand the things. You can't learn all these answers. You will learn, you will forget. And if the examiner will do a little bit change in the question now, you cannot notice that change if you have done the rectification. You have not understood the concept. So concepts are important in PSM. That is my motto here, to give you the concepts. Right? Okay, this is the next question in front of you. The following is true about prevalence and incidence. Who will tell me? Following is true. So both are rates or both are not rates. Or incidence is a rate but prevalence is a rate, or incidence is not, or incidence is a rate and prevalence is not. If you know the formula of incidence and prevalence, you can answer me. What is incidence? New cases upon population at risk into 1000. And what is the formula of prevalence? All cases upon population at risk into 100. Now see the multiplier. Here the multiplier is 1000, so incidence is a rate. And here the multiplier is 100, so prevalence is a proportion. You can learn P for P. So now answer it. Who will answer it? Yes. So incidence is a rate, but prevalence is not a rate. It is a proportion. So correct answer is C. Yes, Rishinika. You are absolutely right. Give me a thumbs up. So correct answer is C. Right. So, okay, we have done the polls now. Let me skip these polls. Let me come on the next topic. The next topic is the death certificate. Death certificate, okay, not death certificate. I'm not teaching you death certificate here. Death certificate I will teach you later on. So let me come on epidemiological studies. Let me start epidemiological studies, the most difficult topic in the epidemiology. Till now, we have seen three things. We have seen three things. What is rate, ratio, and proportion? The difference between them. Each of them have a numerator, denominator, numerator, denominator, numerator. But you know the difference. You know the multiplier and you know the difference well. Yes or no? You know it well, right? After that, we have seen the measurements of mortality. Mortality. We have seen 6 measures of mortality. It is crude death rate, specific death rate, proportional mortality rate, survival rate, case fatality rate, and standard mortality rate. So we have seen which is the simplest, which is the best, which is a burden of disease, which is indicating killing power, which is a positive, which is negative. We have seen everything. Then we have seen the measurements of morbidity. Morbidity. There are only 2 measures of morbidity, incidence and prevalence. There are 6 measures of mortality, but 2 measures of morbidity. Please understand. Mortality के 6 indicator हैं, but morbidity के 2 ही. Please understand. We have seen a relationship between incidence and prevalence, and the formula was prevalence is equal to incidence into duration, and we have seen numericals on this point. So till now we are done with mortality, we are done with morbidity, the indicators of mortality and morbidity. Everyone give me a thumbs up. We have seen that. So with this knowledge, let me move to the third step now, a difficult one, that is epidemiological studies. Okay. What do you mean by epidemiological studies? What do you mean by epidemiological studies? There are 2 types of epidemiological studies. Please understand. I will explain you everything with the crisp knowledge, crisp concept. There are observational studies and experimental studies. As the name indicates, in the observational studies, I will only observe. I am the epidemiologist, right? I am the epidemiologist, like I am the one who will do the experiment, right? I am the epidemiologist, imagine. And in experiment, I will do the experiments. Observation, again, 2 types, descriptive and analytic. Let me explain you. Just suppose, do you know one thing, that smoking leads to lung cancer? Smoking causes lung cancer. Do you know? Yes, everyone knows this. You say, ma'am, yes, of course, everyone knows this. I'm also knowing this. but someone in this world may have proved this for the first time. It is not known the God has told us this story. No, God has not told us this line. Humans have proven it, right? So humans have proven that smoking causes lung cancer. So there can be one scientist or one person for the first time he may have realized and proven it. So how he has proven it, right? So here smoking is the cause and lung cancer is the effect. For every effect there is a cause, right? Lung cancer के लिए smoking is the cause, right? So effect means disease. Effect means disease. So and here smoking is the risk factor or exposure. So you can say for every effect or every disease you have a cause or a risk factor or exposure. So here smoking, what terminologies I will use? I will call smoking as the cause, smoking as a risk factor, or smoking as the exposure. One and the same thing. I will cause lung cancer as the effect or as the disease. One and the same thing. First learn the terminology which I will use ahead in the entire lecture. So if I'm saying cause, risk factor, exposure, I mean smoking. If I say disease, effect, I mean lung cancer. So always fit this example in your mind while studying the entire next chapter. You can take any example, but you have to stick on one example for studying. So this is the best example I can quote. In the park also this example is given everywhere. So smoking causes lung cancer. We will consider it. Just imagine it is not proven. We are the first time going to prove it, right? Just forgot that it is already proven, ma'am. First time I thought, I have seen in my community, in my family, in my neighborhood, in my vicinity, I have seen that the person who smoke, they are having more lung cancer as compared to the person who do not smoke. I have observed this thing. So I am a scientist, I am an epidemiologist, I want to prove it. So I am having a cause, I am having an effect, and I want to make a correlation between two. I will do some experiments, I will prove it. So once I will prove it, it will be published in the books. It will be published. Without that, not just suppose if I say a theory, mango causes blindness. Do you believe mango causes blindness? Do you believe it? Believe it. No one will believe. But I think I have observed it. So what say? Ma'am, prove it. If you think so, just prove it. Then it will be published in the books, and then we will believe it. We will not believe you verbally. So it is a vague thing, right? It is as vague as smoking causes lung cancer. But smoking causes lung cancer do not looks like so weird as it is looking mango causes blindness, because it is not proven. But smoking causes lung cancer is already proven. So you have to prove it. Here mango is my cause, or mango is the risk factor, or mango is the exposure which is causing a disease or effect. Here blindness is the effect or disease. Give me a thumbs up. So anything, if you feel like this causes this, you have to do a protocol. You have to follow a protocol to prove it. So what is that protocol? How? So just suppose this is my theory. Mango causes, I want to prove it. I am a scientist, right? I want to prove it. I have seen this in my community and I am having a strong gut feeling that this is true. But it is only confined to me. I want the world to know this, that this is right, and I am the scientists who have discovered this, right? So I have to follow a protocol to prove it. Give me a thumbs up. So protocol is the studies. What are the studies? So first I have to do a observational study based on, this is my hypothesis. My hypothesis can be anything. Dash causes dash. This is my hypothesis. So mango causes blindness. This is my hypothesis, right? So hypothesis can be anything, but you have to prove your hypothesis for becoming a statement. Hypothesis will convert into statements once you prove it, right? For proving, years are required. It is not a one-day job. For you will require 20 years, 30 years to prove your hypothesis, right? So if you have any hypothesis in mind, in your hypothesis, there can be a and cause and there can be a effect. And that cause lead to that effect. Effect means disease, right? Like I'm saying, mango causes blindness. So mango is my cause or risk factor or exposure, and it is causing a disease. So for proving it, I need many years. So first I will do observational study. In observational study also, I will do first descriptive study. In descriptive study, I will frame a hypothesis. I will frame a hypothesis. So this is my hypothesis. After descriptive study, I will test my hypothesis. For testing the hypothesis, I will do analytic study, but I am not doing any experiment. Natural जो हो रहा है होने देंगे. Then I will experiment on either animals or humans. If I do the experiments on humans, I will take the consent. I will take the consent. And then I will again test my hypothesis in experiment and then prove my hypothesis. Now, in the end, result can be anything. Whether my hypothesis is accepted, if it is right, or if my hypothesis is wrong, it will be rejected, right? So anything can be the result. So we have to follow a peculiar protocol. It is not कि नहीं मुझे तो लगता है तो ऐसा ही है. No, you have to prove it. You have to prove it. So step by step we will move ahead, step by step. So first we will do descriptive studies in which we will make the hypothesis. This study we will do for hypothesis formulation. In analytic study, we will test the hypothesis by case control and cohort study. Two type of analytic study I will teach you in detail. So here these both are arms of observational study. In experimental, the hypothesis is confirmed. So what I am saying to you, in these study, here hypothesis is formulated, here it is tested, and here it is confirmed. So three steps I will go: descriptive, analytic, experiment. Out of the three, the most difficult to understand is analytic. Analytic is of two type: case control and cohort. I will explain you everything, but today is the lecture about descriptive. So today first I will teach you descriptive studies, overview about descriptive, then we will move on analytic tomorrow, and the day after tomorrow we will move on experimental study. So in this way we will complete our hypothesis, and in the end we will see whether our hypothesis is accepted or rejected, whether my hypothesis is right or wrong. So smoking leads to lung cancer, whether I'm right or wrong. I feel so. First time I'm proving it. Forget someone have proven it, right? I'm proving it for first time, right? So observational study, I'm the investigator. I will investigate. I will not intervene. I will allow the natural course to take its own. I will only observe. I will only observe. As the name indicates, I will only observe the things. I am an observer. In descriptive study, I will formulate it. In analytic study, I will test it. Okay, let me come on the, in experimental, I will do the experiments. I will intervene. I will intervene. Here मैं intervene नहीं कर रही थी. I was not intervening. I was allowing the natural course. But in experimental study, I will intervene. Right? Okay. Let me start with descriptive study, which is a type of observational study. Let me start with descriptive. It is the first phase. It is the first phase. In descriptive study, you will do three things: time, place, person. You have to see three things: time, place, person. What do you mean by time, place, person? Okay. These are the steps of descriptive study. Just suppose I mean स्मोकिंग लीड्स टू लंग कैंसर, यही वाला हाइपोथेसिस लेके चलते हैं. स्मोकिंग लीड्स टू लंग कैंसर, दिस इज माय हाइपोथेसिस, आई वांट टू प्रूव इट, राइट? आई एम अ investigator means epidemiologist. So I have done my MD in PSM. I have not done my MD in PSM. I have done my MD in pathology. But if I have done my MD in PSM, I'm an investigator, I'm an epidemiologist, and I want to prove this hypothesis. So what I will do, I have to write everything and submit it to the ethics committee for permission. So first I will define my population, that I want to do a study on a population. So what is my population? My population is entire world, or my population is only India, or my population is some town in the India, some city in the India. My population is Mumbai, or it is Delhi, or my population is some small colony in Mumbai and Delhi. It is Wadala or some particular area. So define your population. Not only define, in your population, how many males are there, how many females are there? Tell me. In your population, tell me the age group. 0 to 1 के कितने लोग हैं, 1 to 5 के कितने लोग हैं, 5 to 10 year के कितने लोग हैं. So give the composition of your population, gender wise also, age wise also, right? In your population, how many are married, how many are unmarried? In your population, how many are businessmen, how many are servicemen? In your population, how many are Hindus, how many are Muslim, how many are Sikh, how many are Isai? So in your population, how many are this? So define your population in all purpose. First, tell what is your population, what is the total number of your population. Out of the total number, how many are male, how many are female, what is the age distribution in your population, how many are infants, how many are under 5, how many are 5 to 10, likewise, and how many are married, unmarried, how many are business service, how many are this, that, how many females are multiparas, uniparas, nulliparas. So define your population in every possible aspect. That is the defining population. Have you got it? First step. So you have defined your population. Population under all aspects. Total number, its composition in terms of age, in composition of gender, in comparison of occupation, businessman, serviceman, how many are rich, how many are poor, the cultural characteristics, you have defined everything. That is defining the population. First step is done. After that, tell me what is your disease. My disease, just suppose my disease is lung cancer, right? Smoking leads to lung cancer. That is my hypothesis. So I want to take disease lung cancer. My disease under study right now for proving this hypothesis, my disease is lung cancer. So define who, to whom, which patient you will call. He's a patient of lung cancer. So you will see, you will see a biopsy report, then only it will be proven, or you will see a CT scan, or you will see an X-ray. So define it before starting your study. I will call a patient is a positive case of lung cancer if he is biopsy proven. Then only I will believe. Otherwise on CT, X-ray I will know. Or on CT, the lesion is this T2, T1 images, whatever. So define your disease. Define. So give an operational definition of your disease in the study. So what is the operational definition? A definition by which a disease or condition can be identified and measured in a definite population. So if I see this is your population, this is your disease, so measure your disease in your population. So you will see how to measure the disease in population. I have told you in the last lecture. That is by incidence and prevalence. So you will see the incidence and prevalence of lung cancer in your defined population. My population is Mumbai. The entire Mumbai is my population, right? That is my population under study in which I will do this study. My disease is lung cancer. My disease, and it should be biopsy proven. That is my definition of disease under study. So I will find all new cases and total cases of all the lung cancer patients in entire Mumbai. So that is defining my disease under my study population. Give me a thumbs up. That is step 2. Now the third step is the most crucial step. The third step, that is the heart of the study, descriptive study. Define your disease by time, place, person. What do you mean by that? Time. So your disease is occurring at some particular point of a year. It is occurring in summers or winters. It is like that. It is occurring throughout the year. During the time span, during the next 10 years, your disease incidence is going on increase or going on decreasing trend. Which trend your disease is following? That is time. Time के हिसाब से अपनी disease को define करो. Then define it by place. Make a map of Mumbai and see, draw your cases in the form of the dots. So dots are the lung cancer cases. So is there any particular clustering in some particular area of the Mumbai? What is the reason behind that? Why clustering of all lung cancers in this particular area? Is there something related here? So measure your disease in terms of place by drawing a map of your population, right? And then persons. Define. So your persons, in which person's lung cancer is more? So lung cancer is more in old person or young person? It is more in males or it is more in females? It is more in married or unmarried? It is more in smoker or non-smoker? So define every aspect. That is person. Then we will come on the conclusion. Then we will frame a hypothesis. Everyone give me a thumbs up. Everyone. So the third step is the most difficult step. We have done the first step. We have defined our population. Just suppose my population is Delhi. So in the entire Delhi, what is the total number of population? Right? How many are males? How many are females? What is the age composition? Married, unmarried, you know, all cultural, rich, poor, everything I have defined. My disease is lung cancer, right? Operational definition, I will believe biopsy or I will believe CT scan. I will not believe verbally. I will go home to home and ask everyone, do you have a lung cancer patient at your home? Do you have a lung cancer patient at your home? Do you have a lung cancer patient at your home? I will ask everyone throughout the Delhi, throughout my population. Give me a thumbs up. So if the person is saying yes, I'm a lung cancer patient. So I will not believe verbally. I will say, show me the reports. We are doing a study and we request you to participate in the study for the benefit of the community, for the benefit of the humanity. You have to participate in the study because we are doing the study on the cases of lung cancer. So we will do a study on you and it is free of cost. It is for your benefit as well as benefit for the entire humanity, right? So show me your reports. If you are fitting in my operational definition, we can consider you in our study. Right, so you should have an operational definition. Now coming on the third step. The third step is time, place, and person. Let me take one by one. तीनों बहुत बड़े हैं. Let me start with time. Time, place, person. Right, time. Let me start time. So you have to see there are 3 types of time. See time, place, person को बाद में लेंगे. See time. Everyone, okay, ये पूरा I guess थोड़ा सा the structure is not good. Okay, there are 3 types of time: short term, long term, and periodic. Some disease show short term fluctuation. Some disease, these are known as epidemics. Some disease show long term fluctuations. These are known as secular trends. And some disease show periodic fluctuation. So our lung cancer is coming in long. So I will teach you all 3. I can take another example also that can come in short, right? If I'm taking example of polio, so it is coming in short. So if I say picorna virus causes polio. Picorna virus causes polio. So this is my hypothesis right now. So my cause is this, my effect is this, right? So polio is showing short-term fluctuation. It comes in epidemic, right? But if I say smoking causes lung cancer, so my disease is lung cancer, it show long-term fluctuation. So some diseases show short-term fluctuation, some show long-term, some show periodic. Some comes like influenza comes in periodic fluctuation. There are many diseases which show periodic fluctuation. So your disease can fall in anything, short term, long term, periodic. Give me a thumbs up. Give me a thumbs up. Now short term. Short term is again of three types. It is difficult to understand. So I will continue it in the next lecture. It is very difficult to understand. Short term, long term, and periodic. After this is time. After time, I have to go on place. In place, I will show you how to make spot maps. So spot map में disease कैसे clustering करेंगे, then person, then descriptive studies will be over, and after that we will move on analytic studies in which we will do case control and cohort studies. So this is the most difficult portion of the entire PSM. Believe me, please believe me. So but the time is limited, so I have to end here. Give me a minute. Let me announce my next lecture. My next lecture is just after 5 minutes, but this is not a lecture of PSM. This is a lecture of pathology. So I am taking a lecture on pathology. In pathology, I am teaching you endocarditis after 10 minutes. So thank you very much for being with me in this lecture. Don't forget to write your feedback in the comment box. My next class is after 10 minutes. That is 12 p.m. sharp. Not on this YouTube channel. On another YouTube channel of Unacademy, that is UA Live. UA Live पे मेरा lecture है. The name is endocarditis. The topic is endocarditis in pathology. So it is a very important topic. You can join me there after 5 minutes if you wish. So please don't forget to give mock test, all India mock test, which is going to happen on 26 January. The pattern and question is predictive of the main exam. So all aspirants of NEET PG 2022 should give it, right? Don't forget to follow my profile link. If you're following my profile link, if you use my code Sajdev10, you can unlock any recorded lecture. So see you all in the next class. In Unacademy, there are two types of subscription. In Plus, you will get access to Unacademy. In Iconic, along with Unacademy, you will get access to Prep Ladder also, right? Once you get the subscription, you will be eligible for all these batches of the top educators, right? These are the various plans available with Unacademy in the Plus and in Iconic. Please check the plans, right? You can see longer the plan, cheaper it is. So you can select any plan of your wish. The exciting news is that if you apply my code SACHDEV Sachdev10 on any of these, you will get maximum discount. So don't forget to apply it before payment and share this code with everyone, with all the medicos of your contact. Thank you very much. Join me back just after 10 minutes at 12 p.m. sharp on UA Live. And after that, at 1 p.m., I will take a lecture for 1. At 1 p.m., I'm having an open house. You know what is open house? You can directly solve your doubts by audio, by speaking to me instead of chatting. So thank you very much. Join both the sessions, and I'm